started for today's webinar, I'd like to welcome you all to Behavioral Health 101, Exploring Best Practices for Behavioral Health in Schools. We're excited you all could join us and hope that you enjoy today's webinar. My name is Alex Mays, and I'm the National Program Director at Healthy Schools Campaign, which is the organization that's hosting today's webinar in partnership with our friends at Trust for America's Health. I'll be moderating today's webinar, but wanted to just start off quickly by reviewing the logistics. Today's webinar is going to run for about an hour, and we will have a recording of the webinar and slides that we will share after the webinar through an email that you'll receive within the week. Also, at the end of the webinar, we have a very quick survey just asking you to provide feedback and tell us how we did. So please, if you could take a minute to do that, we would really appreciate it. And finally, we are going to save time at the end of the webinar today for a question and answer session with our speakers. You can ask questions throughout the webinar by typing in a question to the questions box, which is located on your control panel, and hitting the send button. So feel free to send those questions in throughout the webinar. We'll collect them, and then we'll save them for the end to answer them. We have a wonderful lineup of speakers today joining us. We have Ann DiBiase from Trust for America's Health, Sarah Matthew from the Colorado Department of Education, and Deanna Niebuhr from Partnership for Children and Youth. So without further ado, we're going to go ahead and get started. I'm going to introduce our first speaker, but before I do that, we want to know who is in the audience today. So if you could take a minute to share your response and tell us who you are, that would be wonderful. So our first speaker is Ann DiBiase, who's the Director of Policy Development at Trust for America's Health. She's responsible for defining the agenda and general strategy associated with the organization's goal to create a modernized, accountable public health system and to integrate prevention into a reforming healthcare delivery and financing system. Prior to joining Trust for America's Health, Ann served in 3 policy positions, including as the first Director of Child Health Policy and Advocacy at NEMARS, as Director of Public Policy at the National Breast Cancer Coalition, and as the Director of Children's Dental Health Project. Prior to that, she was the President and CEO of Oak Orchard Community Health Center and came to Washington, D.C. as a Robert Wood Johnson Health Policy Fellow. Ann was elected to Phi Beta Kappa at the University of Virginia and graduated at the top of her class with a Master's in Health Administration program at the Medical College of Virginia. Ann has been an incredible partner in this work, and we really appreciate her taking the time to join today's webinar and for Trust for America's Health in their partnership in hosting this webinar. So before I hand it over to Ann, I just want to share who we have today. So it looks like about a quarter of you are from State Department of Education, a third from nonprofit, and then a lot other, and a mix of state Medicaid and local school districts as well. So thank you for responding to that. And now I will hand it over to Ann at Trust for America's Health. Ann, go ahead and take us away.
Thank you so much, Alex, for that great introduction. I am going to talk a little bit about the Healthy Students Promising Futures Learning Collaborative. Next slide, please. This collaborative was launched last year by the U.S. Departments of Education and Health and Human Services, and it has had support from Healthy Schools Campaign and Trust for America's Health. Next slide. There are 13 participating states in the collaborative, and you can see the list here on the slide. As you'll note at the bottom of the list, it says the collaborative is growing. I want to say that we are pleased to welcome Illinois to the collaborative as a new state team, and many of the state teams are participating on the webinar today. Some of you might be from other states, and we want to let you know that we are open as TIFA and Healthy Schools Campaign continues this collaborative going forward. We are open to other states joining us. Next slide. So what the collaborative's goals are really to increase access to school-based health services. So what these teams are trying to do is to scale up health services in schools. They're doing that by implementing a specific state vision and strategy, specific to their state. They've identified and assessed a whole bunch of options for how to deliver health services in schools. And they're addressing barriers and leveraging new opportunities related to those options, including through the Every Student Succeeds Act implementation in their state. They're receiving technical assistance on different delivery models, on Medicaid reimbursement and policy, and they're hearing about federal and state policy opportunities from policymakers as well as from national and state organization partners. Finally, they're assessing opportunities for innovative partnerships as they seek to scale up services in schools. Next slide, please. So I mentioned that they've been identifying innovative strategies and partnerships. That's because we really see a range of ways to deliver health services in schools and to be reimbursed for those services. So teams are looking at things like delivery models through a school nurse or other specialized instructional support personnel in the school. They're developing relationships with different Medicaid providers such as hospitals, federally qualified health centers, school-based health centers. They're thinking about the role and opportunities of managed care in Medicaid in their state. They're identifying some innovative models for expanding capacity, such as mobile and telehealth. And they're thinking about how to serve specific student populations or students with high health needs that impact their learning, such as diabetic or asthmatic students. Next slide, please. What we've heard from the 13 teams that have participated so far in the collaborative is that behavioral health is a really critical need, one of their top concerns. And the things that they think about as we talk about how they can increase behavioral health services in schools are the workforce shortages they experience in their state and community, funding for services, potential partnerships with healthcare and other community-based organizations, including behavioral health providers. They think about how to identify and assess unmet needs in their populations. And bottom line, the teams know that learning and behavioral health are interconnected and each supports the other. So what we've heard they're interested in is really thinking about how to promote and address kids' mental health to help them learn. And now I want to turn it back to Alex to introduce our next speaker.
Great. Thank you so much, Anne, for that great introduction. I really appreciate it. So I'm going to introduce our first speaker, or second speaker, I should say. But before I do that, we are going to run another poll question, wanting to know how familiar you are with the multi-tier system of supports framework for behavioral health. This is something that our next speaker is going to be sharing much more information about, so we wanted to get an idea of the knowledge in the room. So our next speaker is Sarah Matthew, who is the Director of Health and Wellness at the Colorado Department of Education. In the Office of Health and Wellness, she oversees many grant-funded initiatives addressing physical education and activity, school nutrition programs, school Medicaid programs, traumatic brain injury programs, Title V abstinence program, and others. Sarah also works in collaboration with other state agencies to implement the Healthy Kids Colorado survey and the School Health Profile Smart Source data collection efforts. In the past, Sarah served as a public health advisor with the U.S. Department of Health and Human Services and as a coordinated school health specialist with the School District of Philadelphia. So Sarah, we really appreciate you taking the time to join us today. So just briefly, here are the results from the poll. So it looks like about half of people are not familiar with the MTSS framework, and then some are very familiar, moderately familiar, but it looks like we all will have the chance to learn more from Sarah in her next presentation. So I will go ahead and hand it over to Sarah now.
Thank you very much, Alex, and thank you for allowing me to present the work that we're doing in Colorado in addressing behavioral health in our schools. I'm going to apologize up front. I've had a cold this week, so I hope I get through without losing a lung while I'm here. But if I have to cough, I will try my best to hit mute. So I'm going to touch briefly at first on what MTSS is and our statewide framework, and then I'm really going to dig in a little deeper into what it looks like at the school level. So next slide. In Colorado, The MTSS framework is a multi-tiered system of support defined as a prevention-based framework of team-driven, data-based problem solving for improving the outcomes of every student through family, school, and community partnering, and a layered continuum of evidence-based practices applied at the classroom, school, district, region, and state level. Next slide. There are 5 essential components, and this is our Colorado state model. There are 5 essential components to the MTSS framework. The first one, next slide, is team-driven shared leadership. Schools, districts, and the state are attempting to team up and build structures and expectations that distribute responsibility and shared decision-making across the school, district, and community members. That includes students, families, generalists, specialists, district administrators. To organize coordinated systems of training, coaching, resources, implementation, and evaluation for adult activities. Next slide. So once these teams are formed, they engage in the data-based problem solving and decision-making process. And it's been very clearly defined here through our work what that looks like. But essentially, we use a few different data sources here to make decisions concerning behavioral health. This framework is not exclusive to behavioral health. It's really meeting the needs of the students in the academic realm as well. But for the purposes of this discussion, I'm going to focus mostly on behavioral health. The data sources that schools are using are their school climate and culture surveys, our Healthy Kids Colorado survey, which serves as our youth risk behavior survey. We've partnered with other state agencies here to really have a combined, really robust data collection at the student level, and so that's referred to as Healthy Kids Colorado here. And the Smart Source, which is our school health policy and practice data set, also driven by a CDC grant, but really looking at what policies and practices are being implemented at the school level to address behavioral health. And we also encourage these teams to really take a look and dive into their behavioral referral data at the school level. Next slide. For a successful MTSS, it relies heavily on family, school, and community partnering. As you know, with the Medicaid dollars, we're all working together with our Medicaid school health services teams, and it looks a lot like that here. Collaborating with families, schools, and communities as active partners to improve learner, classroom, school, district, and state outcomes. Next slide. The target or the main body of work under MTSS is to offer a layered continuum of supports to schools that ensure every student receives equitable academic and behavioral support that is culturally responsive, matched to need, and developmentally appropriate through layers that increase in intensity from universal to targeted to intensive supports. And again, we're going to get into what this looks like at the school level in just a minute. Next slide. As with everything in education, we tend to really rely mostly on evidence-based practices, but we do allow for innovative practices at the school level, and so it looks different at every school and district across. But we are really encouraging districts to use evidence-based practices and approaches to instruction, intervention, and assessment that have been proven effective through research, indicating positive outcomes for all students. Next slide. In Colorado, we are currently the recipients of a grant called the SPDIG. I'll talk about it a little bit later, but that is the funding for this statewide work. It's the School Professional Development Grant. It's a Department of Ed grant that has come to the Colorado Department of Education and helped us to build this statewide infrastructure to implement MTSS at the school, district, and state level, and even at the regional level. So for MTSS implementation to be successful, it's critical to establish leadership teams at each level of that system. And these teams will ensure effective implementation across all of the systems, including school, classroom, and individual students. Initially, the team will come together and build a common vision and establish common language. That's very important in order to create shared purpose and desired outcomes. Through database, problem solving and decision-making, system support needs are identified and plans are constructed, and leadership teams engage in ongoing review and evaluation of progress data to determine how funding should be allocated and what available resources. So that's a little bit about the state grant. The state grant lives at the Department of Ed in a different unit. It's in the Learning Supports unit here. And we've just gotten that grant up and running, and we are really excited about the statewide work because we heard continually from districts that they really wanted the state to be more coordinated at our level. And so this funding from the Department of Ed has really helped us to achieve that. Next slide. So the school behavioral health framework is what this really looks like at the school level. And this framework we developed in partnership with Colorado Education Initiative here. There are many partners involved in the construction of this particular framework. And we have an actual guide to using this framework that we share with schools that are trying to get this work started. And yes, I will share it at the end of this presentation so that you can access the guide as well. So when we look at this framework, foundational pieces at the bottom are really those where districts and schools have strong family, school, and community partnership. They're able to implement school-wide efforts to reduce stigma around behavioral and mental health. The staff have opportunities to engage in quality professional development that address social and emotional learning and behavioral health systems. That would include trauma-sensitive schools and culturally responsive schools and understanding of adolescent development. So those are foundational to our school behavioral health services framework. And what we really look at is making sure that schools have at least 3 to 5 of those in place already. They really should have a strong foundation before they kind of try and implement the whole framework. So some schools are actually working on those foundational pieces in the beginning. The next here is the universal support for all students. So this is where all students would receive services such as positive behavior intervention support, universal behavioral health screenings, evidence-based practices on social emotional learning, and that would exist across all grade levels. And a very strong behavioral health referral process must be in place in this Tier 1 universal level. Tier 2 is for some students. We think of universal being for all students. Tier 2 is for some students that needs don't seem to be met with Tier 1. Traditionally, these students have been in need of early intervention support, but they've been dealt with through disciplinary and reactionary approach. We're trying very hard to really move past that and implement a more comprehensive behavioral health system so that these students could be linked to care in Tier 2. And therefore, they might be able to get interventions at an earlier level and not move up the pyramid, so to speak. Tier 2 at the school level would include evidence-based group and individual interventions. Tier 3 is tertiary, I never have said that word well, tertiary and intensive interventions. This would be for a few students. These are, this is where schools would have really strong crisis response systems in place, and they would offer individual and group therapy at the school level and really be partnering well with community-based organizations to provide strong reentry programs for those students that might be transitioning back to schools between providers or hospitalization. We know that these students one of the key pieces to Tier 3, and probably the most exciting piece to Tier 3, is making sure that we have a really strong referral system with a loop back on communication between those providers and the schools, so that we know that students that we're referring are actually accessing the appropriate services and receiving those services. If you look up to the left, you'll see linking with systems of care. That really happens at Tier 2, mostly Tier 3. But we want to make sure that we have really strong communication and adequate information sharing, a really nice handoff between the school and the provider or the care provider or the care system. That this is where wraparound services are provided, and these should be youth-driven and family-guided services. Youth and families should be involved at all levels of this framework. As I said before, we have a guide to help you with implementing this framework, but at this point, I think I was going to stop and see if there are any questions I could answer concerning the school behavioral health framework, or Alex, if you think we should wait till the end, that's fine too.
Oh, sorry, Sarah. Let's wait. Let's hold off until the end, if that's okay.
Okay.
Just to give people a chance to process. And yeah, so please, certainly, if you have questions about the information Sarah shared, send them in. But let's save them until the end, if that's okay.
Great. So I'm going to go ahead and say next slide. In Colorado, we have really been investing in school behavioral health. We heard many years ago that that was the greatest need, both in the health realm and in the academic realm. Teachers were asking, school health professionals were asking, and of course, the biggest question to come up was funding. And so we have really worked hard to braid and capitalize on the existing funding sources that we have and to really bring in more funding into districts and schools to do this work. So at the Colorado Department of Education, we have been building in the infrastructure to support school mental health, with the coordinating piece being the Medicaid School Health Services Program. We also are the recipient of the Project Aware federal grant from SAMHSA, and we have used our marijuana cash tax fund to support school health professional grants to schools. We also have used some of those marijuana tax cash funds to provide programmatic level funding for bullying prevention programs, and the SPDIG is that grant that's really building that statewide and district infrastructure for MTSS. Next slide. So Medicaid in Colorado is a little bit different than many states. In 1997, we passed statute that supports that all the Medicaid school health services funds are to support the health of all students. That really gives us a lot of leeway in supporting behavioral health, especially across the continuum. Next slide. In Colorado, our school Medicaid services program is a very strong partnership between the Colorado Department of Healthcare Policy and Financing. So HICPOF, as we fondly call them, are the agency that assists districts in drawing down the money and figuring out whether it's cost beneficial for them to participate. At the Colorado Department of Education, we partner with districts on developing strong local service plans that will address the health needs of all their students. So one of the really exciting things about this partnership is that we have someone here in our office whose job it is strictly to work with districts on figuring out how to utilize their school health services monies in the best way. As part of that, as you can imagine, behavioral health has risen to the top as the primary need across our districts. As part of the local service planning process, many districts choose to direct funding to mental and behavioral supports for all students, including financing school health professionals, training and program support. In Colorado, we define school health professionals as school health nurses, school social workers, school psychologists, and school counselors. In 2015 to 16, over $4 million school health services dollars were spent on mental and behavioral health in Colorado schools, and funding went to over 62 FTE across our state. Next slide. We were also fortunate enough 2.5 years ago to apply for Project Aware. This is funding that comes down through the Substance Abuse and Mental Health Services Administration. It is federal dollars that are meant to build a comprehensive, coordinated, and integrated school behavioral health system that supports every student in Colorado in reaching their fullest potential in school and in life. This grant was actually born from Sandy Hook shootings. It is a really wonderful grant. I believe 20 states received it in the first round. We are now 2.5 years into a 5-year cycle. We have been extremely fortunate to work with SAMHSA on this grant. It really is a wonderful companion and what we consider the pilot for all the behavioral health work that we plan to do here in the state over the next many years. Next slide. One noteworthy piece to Colorado Project Aware is that we are very devoted to authentic youth engagement at the state level. As part of Project Aware, we have actually hired 2 youth advisors that live in our office, and they are, we define youth as youth aged 9 to 25. So they fall actually in the 18 to 25 age group. But they are working to build a youth system across the state, and they are working in partnership with adults. We don't see them as mentees as many as we may have learned from in the past. But we are building a statewide youth engagement system so that youth are engaged at every level, both the school, district, state, and hopefully federal level. We're working on that. Component 1 of this grant comes to the Colorado Department of Education, where we engage behavioral health stakeholders from across the state to improve mental health awareness and response in schools. In addition to broader statewide activities, Project Aware has partnered with 3 local education agencies to build and support best practices that will inform Colorado schools and communities interested in accomplishing similar goals. So we picked 3 LEAs in the RFP process. They had to already have some knowledge of the MTSS framework, since that's what we were building on. Those districts were chosen based on different needs. So in Aurora Public Schools, we had recently experienced a shooting in a movie theater there. Our schools were definitely traumatized, and they were definitely trying to build response to that event. Fountain Fort Carson is a half-military health local school district, and we learned very quickly that all of the youth that are in the schools there have been born during deployment time or during wartime, and that population has been known to experience disproportionate behavioral health and mental health problems. In Thompson School District, they had recently experienced excessive flooding where there was a tremendous increase in homelessness in their district. All of these LEAs will be involved for all 5 years of the grant, and they had to agree to take part in this process from the very beginning of the grant, and we are not allowed to switch or add districts in this process. Next slide. In addition to our 3 LEA partners, Project Aware is implementing youth mental health first aid training across our state. Using this and other evidence-based programs, Project Aware aims to improve school climate, safety, and substance abuse prevention. Through increased collaboration based on a multi-tiered system of support model, we will be developing sustainable funding for the provision of high-impact school and community-based behavioral health services. So component 2 is really building that statewide infrastructure, and we have a behavioral health advisory council that is part of component 2, and then we are doing statewide youth mental health first aid training all over. The next slide. The next grant program that I wanted to talk about, or funding source, is the Colorado School Professional Grant school health professional grant, sorry. So we used to be known for our beautiful mountains here in Colorado. Now we're known for something other than that, which is that we legalized marijuana 3 years ago. And in legalizing marijuana, we certainly wanted to make sure that we were going to address the marijuana education issue in schools. So we have funding. It started out with $3 million. It was cut after the first year, but now it is $2.8 million that goes out to fund school health professionals. We heard from schools that when youth are starting to experience problems with substance abuse, these were the 4 professions that would be called in to assist them. So we wanted to make sure that schools had funding for those professionals, and they are, again, school-based: school psychologists, school counselors, school social workers, and school nurses. School districts can apply for FTE, professional development and training, and resources to implement high-quality behavioral health programming, including evidence-based programming that address substance abuse prevention and universal screening. Up until this year, we received $2.28 million, and we funded 66 schools, 44 FTE across those schools, and 22 district-level grantees. As part of the 2017-2018 appropriation, we've seen an increase of $9.4 million. So that will get us up into the $12 million realm. Right now we have an RFP that is open for all schools. It is very exciting for our districts because based on the work that that first cohort did of that were funded with the $2.28 million, we really feel like we've built a foundation, build on the multi-tier systems of support, of course, but we're going to be able to fund virtually 150 more FTE across our state with these additional funds. We are in that process right now and are scheduled to have that money go out in July. Next slide. I've touched on this already, but one of the grants that we receive here that supports our behavioral health framework is funding from the U.S. Department of Education, and that is to implement that multi-tiered system of support at the state, district, and regional level. It's called the School Professional Development Grant. We call it the SPDIG, so I have to think about what the letters mean. But these models will result in increased implementation of evidence-based practices to improve academic and behavioral outcomes for all students in Colorado, including those with disabilities. The thing that's important to note about this is that it's got minimal funding that goes to schools that participate, so it's really a great companion to Project Aware and also to our school health professional grant. Next slide. Also through our Marijuana Tax Cash Fund, we are funding school bullying prevention grants. This is another grant that just got up and running in the last year. So this is authorized through statute to implement evidence-based bullying prevention practices with fidelity. It will include family and community involvement in bullying prevention strategies and adopting policies concerning bullying education. In 2016 to 17, 14 districts have received small grants that they will distribute to 73 schools. And the overall appropriation is $2.9 million. Next slide. I'm not going to read this to you, but one of the things we are most proud of in Colorado is that we have built out the comprehensive health education standards to the same level as reading, writing, and math. We value health. All of this work falls under our comprehensive health education standards. We are required through statute to revisit those standards every few years, and we are in a revision process. And what we are doing is looking at making or bringing social emotional standards and making them cross-cutting across content areas. So for instance, recently we've actually built out units and even student learning objective level units that actually address social emotional learning in conjunction with science, in conjunction with language arts. So we've even made integrated units as a part of this. All of our standards are built by teachers for teachers, so we bring together teachers in the field, and we include school health professionals in the writing of our standards. These standards have gotten national recognition, and actually many have been adopted by many other states. We consider that the most foundational piece to the MTSS work, but really to all our school work. Everything is connected to our standards, and we're very proud of them. Next slide. I'm happy those are also going to be a resource that I share with you at the end. There's a link that I've provided, and you can access all our health ed standards online. So that finishes up my portion of this, and I will hand it back to you, Alex.
Wonderful. Thank you so much, Sarah, for that great presentation. We really appreciate you sharing in such wonderful detail how you fund the behavioral health services in Colorado. And I certainly learned a lot, so hope participants did as well. So I am going to transition to our next speaker, who I will introduce. Deanna Niebuhr is from the Partnership for Children and Youth, which she joined in 2004, and there she directs the Community Schools Initiative. In this role, Deanna leads PCY's efforts to create a state-level policy framework supportive of the development and sustainability of community school implementation at the local level. Deanna is focused on building a statewide information sharing network of community school advocates and stakeholders. She also oversees PCY's targeted technical assistance work with local communities to initiate and grow community school partnerships. Prior to joining PCY, Deanna worked with adolescent girls in a group home and non-public school setting. Deanna has a bachelor's degree in psychology from University of California, Berkeley, and a master's degree in public policy from the Goldman School of Public Policy at UC Berkeley. So thank you so much for joining us today, Deanna, and I will now hand it over to you.
Thank you. So if you'll move to the next slide, you'll see that a major part of my work is developing the California Community Schools Network, and through that network we partnered with the California School-Based Health Alliance to create a set of principles for building school-based mental health systems. And for this webinar, I pulled from a slide deck that our two organizations use to conduct learning sessions for school districts to do this systems building. And I just want to acknowledge that California's Department of Education did launch last year a training program for MTSS that's statewide. So I just wanted to acknowledge that for any California folks that are on the call. And then also to provide a broad context for the systems building work. In California, Medicaid dollars for young people to receive mental health services flows through our county health departments. And then there's no specialized Medicaid funding going to school districts except to support mental health services provided through special ed. So historically, while it's not across the board 100%, our school districts' experience with providing mental health services happens in a special ed context. So a big part of what we were trying to do with this systems building work is to help school districts think about serving all students. So if you'll move to the next slide, I'll just point out that we start these sessions by acknowledging that that this is the context that school districts are working in, and validating that because of our funding structure, that there's been a service gap, which the school districts, without officially having responsibility for serving all students, they certainly do see the need. So if you'll move to the next slide, I'll also say that California recently changed its education funding system so that school districts now have moved from a categorical funding system to now having local control and more decision-making power over what they spend their money on. And with that, we saw a lot of districts hiring mental health workers to meet this service gap. But but what we know is that the need is so great and the needs are very broad that a single mental health worker will very quickly get swamped. And therefore, our answer is to do comprehensive systems building training. And you'll see on this slide the 6 basic principles that we cover in these learning sessions. And we present them here in a circle. What we imply and talk about is that there is a cycle of ongoing improvement. So if you go to the next slide, we'll see the first principle is that you start with a needs assessment. And I will say that if we move to the next slide, we really encourage folks to start this needs assessment process by building a diverse planning team that will build out the needs assessment and be able to add to that, looking at existing services and thinking about whether those are responsive to the full student population. So if you move to the second principle, related to that diverse team that will be in charge of this process, the planning process, we emphasize that the planning considers youth involvement and cultural competency. So if you go to the next slide, the way that we sort of delve into that, or the highlight that I would bring out here, is that in all of this there are youth and family advisory committees, so that the design and delivery and really marketing of these services, the services that are chosen, are representative of your school communities. And then the third principle, if we move to the next slide, is that mental health services are built out of a positive school climate. So if you move to the next slide and look at the tiered system. So what we find is that hire a mental health worker. There's a lot of work in Tier 3 where students would be getting one-on-one counseling. And what we're emphasizing in this systems building is a big focus on this Tier 1. What are you doing for all students? What does your school climate look like? And if you go to the next slide, we kind of detail what the tiers look like in a more comprehensive system. And what we've found with school districts is if they do a real comprehensive effort on Tier 1, they actually see huge declines in their needs to refer to Tier 3 or to actually refer to mental health workers. So if you go to the next slide, principle number 4, and this is sort of going back to that's the funding structure. So a big part of this training is to help school districts understand that they need their community partners to actually provide the mental health services. So a lot of in this training what we do is help school districts understand how this funding is flowing, that their county health departments actually have a funding stream that they should be tapping into. And then our experience is that schools, if they have been providing services for all students, have relationships with their community-based partners, but need the understanding that the contracts that those partners are working under are actually administered by their county health departments. So what we're really just doing here is almost advocacy training to help school districts understand where the funding is and what partners are critical to make sure that they can bring the services that their students need to the school context. And if we move to the next slide, it really sort of just shows you the depth of what we're helping schools to understand once you have those partners in place, what those partnerships should look like. And then if you move to the next slide, principle number 5 is, okay, so now we've figured out how to pay for mental health services. We have our partners in place, making sure that when we hire that mental health worker to be on school site, that they just don't show up and work alone. We really emphasize that mental health services should be part of a coordinated school site team, a multidisciplinary team. And if you'll move to the next slide, it shows that we sort of delve into how these teams work, but really the emphasis here being that if your mental health worker works with a team, then you're coordinating your mental health services with other services you're providing to students. They make sense in one time, one single place case management, and this team can help you think about all 3 of those tiers. So is that system working, that more comprehensive system with those 3 tiers working at a school site? It's this team's job to assess that. And then the final principle, if you move to the next slide, is really sort of the making this fully comprehensive. If you've already got teachers and your mental health workers working on a multidisciplinary team, we're trying to make full use of bringing that mental health expertise to your school site. And the principle here is that professional expertise is shared with other staff through professional consultation and advice to the team about what kind of training should be provided to all staff to create those strong, positive school climates, understand how and when to refer students, and all of that kind of thing. So if you move to the next slide, that sort of lists out some examples of what those competencies for teachers and other school staff might be that your mental health professionals would add to the conversation about what the need is there. So I ran through that fairly quickly, but that gives you a taste of the kinds of things that we do in a much more in-depth training with school districts. So that ends my part of the presentation, and I'll hand it back to Alex.
Great. Thank you so much, Deanna, for sharing that. So now we are going to go ahead and get started with our question and answer session. Please feel free to chat in your questions through the questions box on your control panel, and we will make sure we get to them. I'm now going to hand it over to Anne and Jenny at Trust for America's Health, who are going to facilitate our question and answer session.
Thank you, Alex. We had a question here that's directed towards Sarah. The question, Sarah, is you mentioned a few specific data sets specific to your framework in Colorado. Who is responsible for obtaining and analyzing that data? What have you learned from those analyses thus far?
Hello. That's a great question. The Healthy Kids Colorado, which is the YRBS, is collected through a partnership with 3 state agencies, so CDPHE, the Colorado Department of Public Health and Environment, the Colorado Department of Human Services, and the Colorado Department of Education have all contracted with the University.
Thank you. I have a couple of other questions here, so I direct this to both Deanna and Sarah. Wanted to ask, we've heard about some examples where the state departments of education or nonprofit organizations are taking the lead in implementing these behavioral health frameworks in schools. So what role does the state Medicaid agency play within these partnerships? How have you engaged them within your current work? Sarah, do you want to start?
Can you hear me?
Yes.
Okay, gotcha. I'm sorry, can you rephrase the question?
Sure.
Or repeat it?
The question is about partnering with your state Medicaid agency. So how has the Colorado Department of Education partnered with their state Medicaid colleagues on this work?
Sure. So we partner with the Healthcare Policy and Financing, And what they do is assist districts in drawing down the money and distributing the money to schools. And then we assist the schools in building a local service plan, reviewing that, and reporting on that every year. So that's our strongest partnership. And we also engage other stakeholders, Colorado Department of Public Health and Environment and the Colorado Department of Health and Human Services to be a part of the Medicaid School Health Advisory Committee.
Thank you. Deanna, did you want to also respond to the question about how you might be working with your state or local Medicaid colleagues?
Yeah, so I would say that based on that funding structure that I described at the beginning of my presentation, our big focus when we are reaching out to school districts is also to try to educate our county health departments about the important role that they could be playing if they had a closer partnership with our school districts or with the school districts within their catchment area. So that is a big part of our advocacy work, training the school districts to make the case that school-based, that there should be an investment in school-based services, but also, you know, just trying to help negotiate those partnerships and do that awareness raising on the county side too.
Well, thank you both for those answers. We have a different question that either of you can address, or both of you. It's about, for team-based care, how do you counter issues with HIPAA and FERPA, the privacy requirements in healthcare and education respectively? Do you want to start this time, Deanna?
Yeah, I'll start, and I would say our partner, the School-Based Health Alliance, does a lot of the work around HIPAA and FERPA. They do a lot of training for districts and in-depth work with districts to help them understand how to make sure the HIPAA, FERPA principles are followed, and that's part of what we touch on when I talked about those school-based multidisciplinary teams, that those teams are very effective, but they're also very disciplined in how they address and hold true to HIPAA and FERPA and still do, you know, the more powerful work. So absolutely yes.
And did you also want to answer that, Sarah?
Sure. In our office, we have our school health service program that is largely under our state school nurse consultant, and she does trainings with our when we go out and do Medicaid trainings on the HIPAA and FERPA issue to make sure that all the professionals are kept up to date on those regulations. So it is part of their yearly training here.
Thank you. I also wanted to point out that the U.S. Department of Education does have a toolkit on HIPAA and FERPA, and there's also materials available through the National Health Law Program, one of the national partners in the collaborative. I wanted to just loop back, if we could, with you, Sarah, because I'm not sure your entire answer was heard in regard to the first question about obtaining, analyzing, and learning from data. So if you wouldn't mind just expanding upon, because we didn't hear your complete answer there, or at least that's what we've heard from our audience.
Sure. We have the Healthy Kids Colorado, which serves as our YRBS, and that's a tri-agency partnership that we collect that data. It's analyzed by CDC, and we actually partner with public health here, and they actually get school and district and regional level reports back to schools. The other data that's collected is the school climate and culture data, and that's by a district level team, and that information is filtered right back to schools so that they can make database decisions on what they are really collecting in real time. The last one is our Smart Source, which serves as our school health policy and practice data set. We partner with the Colorado Education Initiative and Kaiser Permanente on that data, and we are, that's collected by Colorado Education Initiative and housed there so that that can drive what policies in response to the student level data. So what policies they implement in response to their student level data, those two are matched very closely with each other. Thank you.
Thanks, Sarah. I have another question for you both. I'm wondering if you have recommendations for states on how they can incorporate behavioral health into their ESSA or Every Student Succeeds Act implementation plans. And we know some of those states, about 10 states have already submitted those plans. That means the bulk of states are still working on their plans for submittal to the U.S. Department of Education. So do you have recommendations on how states can incorporate behavioral health within that plan?
So I'll go first here. At the Colorado Department of Education, we've engaged stakeholders from across the state. We had many focus group meetings across the state, and we really engaged a lot of health partners. That being said, it's very much a local decision piece that we are educating districts about how they can utilize ESSA dollars to implement strong school health programs. And we're doing that in conjunction with many partners, with the Colorado Education Initiative, who is our strong partner in working with districts on this issue. But we really have not finished our plan at the moment, and we're really looking at informing districts on how they can utilize the dollars at the district level. Deanna?
Yeah, I guess I would just say, based on the other questions, that I think there's probably a real importance for there to be a state presence in the training of how to do this, and especially focusing on the systems building. I think both of these presentations kind of emphasize that, and I guess I would just encourage people to, with that kind of thinking, to weigh in on the ESSA planning, to build that in, how to help districts and local communities build systems, so you're not just focusing on it's so common to choose evidence-based practices, and there needs to be a system in which those evidence-based practices are being chosen and evaluated about how they're implemented. And I think that goes to also, that the HIPAA-FERPA questions come up, just the great need for helping folks to negotiate those important rules and still within that build effective systems that are responsive. So I'll just emphasize that part for your ESSA planning.
That's very helpful. I'm going to try to sneak in one more question because I know it's one that is top of mind for lots of folks. And I'm combining two questions here to ask you both about billing for services. So there's questions about whether you actually bill Medicaid for services provided in the schools to you, Sarah, and also to both of you, whether you've engaged any other healthcare payers to see if they would reimburse for any of these evidence-based approaches to social and behavioral health interventions. So Medicaid payment and other insurers.
So this is Deanna. What I just described and what we're trying to do by training school districts in this way, and also our county health departments, is we are very focused on those Medicaid dollars, EPSDT, that are flowing through our county health departments to be used to pay for mental health services for our Medicaid eligible students in a school setting. That is a big emphasis in what we're trying to build out. Otherwise, we have education dollars being used to pay for, something in the medical realm that, and not tapping the Medicaid resources. So I would say that's what we're striving for.
So yes, I will admittedly say I'm not the expert on how we bill, but I know that we are allowing districts to bill for behavioral health services at the school level. That's about all I can say at this point. I could I'm not the school Medicaid expert in my office. They would have much more information than I.
Okay.
Well,
Well,
if you'd like to filter a question by email, I'll get a better answer.
Great, thank you. Well, I want to just thank everybody for participating in the webinar. We're at the top of the hour, so we will conclude now, but we want to thank you all for participating. This webinar will be posted on Healthy Schools Campaign's website, so we hope you will share it with others who are interested in thinking about how to create systems of behavioral health services and supports in schools. Thank you very much for your participation today. There is a survey, so please do take the survey before you sign off. Thank you, and have a good day.